Good afternoon, everyone. My name is Marianne Monroy, and I'm here with a colleague, Tamir Aldad, and we have the honor and pleasure of presenting on a topic called Clinician Health Thyself, Heal Thyself, how to assist struggling clinicians and address disruptive behavior. So we'll just start off with telling you all a little bit about ourselves. I am the chair of the Employment Law Department at Garfunkel Wild. So I handle a lot of the day-to-day counseling of our clients, healthcare facilities, hospitals, anesthesia practices, ASCs. Besides the counseling, I do litigation, broad range from discrimination, wage and hour. Also handle things like investigations, counselings, and disciplinary actions. So that's a little bit about myself. I'm going to turn it over to Dr. Aldad to introduce himself here too.
Perfect. Thank you, Marianne, for having me. I'm Dr. Tamir Aldad. I'm an addiction psychiatrist by training and currently the CEO of Mindful Care. Mindful Care is the first ever psychiatric urgent care chain serving New York, New Jersey, Connecticut, Michigan, Illinois, and Florida, providing same-day, next-day psychiatric care along with long-term medication management, individual therapy, group therapy, and substance use counseling. Very excited to be here to discuss this issue as we see a lot of patients with same-day, next-day concerns, some advised by their friends, family, and or employers to seek help. And we're there at the forefront and on the front lines. So certainly an important topic, and I'm glad to be here to discuss it today.
Great, great. So I'm going to move on to our first slide. And what I have at least noticed in my legal practice, and I'm sure Dr. Aldad has noticed in his professional practice as well, that there has been an uptick in issues for employers dealing with their staff who have health issues and how to handle those health issues and balancing operational needs with doing the right thing by employees, okay? Because many of your employees are going through real health concerns. It's a very stressful environment, the healthcare field, and you want to be supportive, but at the same time, protect your business interests, protect patient quality of care. Most situations are very fact specific. And so while we're going to go over today some issue spotting, maybe identifying, red flagging legal issues for you, it's really best to make sure you're working with your HR team, maybe contacting counsel as well, to make sure that you're not going to trip over any legal requirements. We're also, Dr. Aldad's going to talk about resources for employees, because that's a really important thing, that you put the employees in the right direction to get help. I always say when we do training sessions for employees, the point of counseling and discipline is not really to be punitive, but to help employees get on their feet, improve, and deal with performance issues. And performance is very often affected by health concerns, okay? And then we're also going to spend a little bit of time talking about disability accommodations, because you really can't have a discussion like this without understanding your legal obligations as a facility, as an employer, to consider disability accommodations. So when Dr. Aldad and I were brainstorming about things to talk about, things that we have come up in our, his medical practice, clients of ours, these scenarios where, I get a call or he gets a call like, look, I have this employee or a patient, they're overly angry, they're antagonistic. What do I do about that, right? Sometimes the inclination is I'm just going to pretend it doesn't exist. I'm going to ignore it, right? And as we walk through the slides today, we're going to tell you that that's not the best action to take, that you really do need to investigate something, sometimes engage in a dialogue about accommodations and get to the heart of the matter. Some other things there, and maybe some of you have run into these safety concerns, because you might notice an employee who's being erratic, labored speech. You might believe that they're using alcohol or drugs. What do you do in that scenario, right? And you have to make sure that you protect safety. Missing deadlines, or you might have an elderly employee who's forgetful, or maybe they're a surgeon and he's shaking hands, right? These are things, real life things that many of our clients and your patients deal with and having to address. So I think we're going to move on to some more of the substantive slides.
Yeah,
Okay.
I would just say, as somebody is listening and watching this, it's important to realize that a lot of times, so healthcare in general, we're at high risk of burnout. The employees that we have across both the MSO and PC side of the business are at high risk of burnout, and there's a lot of decisions that need to be made that have serious consequences, and it isn't as forgiving as perhaps other jobs. And we need to remember that we really have to protect our patients, our employees, the entire organization. And sometimes when you try to be a good Samaritan or let intuition dictate your next move in response to a situation, it actually steers you wrong. So the purpose of our conversation today is really to be systematic and methodical in the way you assess situations, so you're objective every time you're faced with one of these problems. And it's important, as you're listening to this conversation, you look at it through that lens rather than feeling that you'll cross that bridge when you get there. Because if you're not prepared and there is no contingency plan, and you think you'll just do the right thing, or you'll just have the best of intentions and that will guide you, many times it guides you to failure, and there are severe consequences.
Absolutely, absolutely. Well said. So, and some of the things when you're doing that analysis we have on this next slide, protecting patient safety, that's paramount, right? So if one of those scenarios on the first slide presents, right, and the person maybe has incoherent speech and they're talking to themselves or doing something that is suspect, unusual, and gives you, pause for concern, right? First and foremost, we got to protect patient safety. So when I'm fielding some of those calls, many times, whether you call it suspension or a leave, but you're going to have to put somebody out pending an investigation to make sure that patient safety is taken care of. And I will tell you, and it's later on in the presentation, don't jump to conclusions. I've had situations where it was reported that, a physician was incoherent and they were seen talking to themselves, right? And then we do an investigation. Turns out that they were listening to a language tape and learning a particular language and repeating back, whatever the phrases were on the tape. So there wasn't really a concern there. Also, disruptive behaviors, right, by those in the medical profession can lead to really adverse outcomes for patient care. And we see that quite often, that if you don't address some of the disruptive behaviors, whether it's the irate clinician, the clinician that throws things, the one that everybody's afraid to speak up and out against, right, could lead to adverse actions. And we've come across situations where nurses were afraid to say something because they thought that they would be verbally attacked, and patients have died. So it's really important that you address those kinds of things. The next thing you want to consider is, once you get the patient care safety addressed, what about the employee safety? Are they engaged in some kind of conduct where you are immediately concerned from a mental health standpoint, or just a regular disability standpoint, right? Do they have to go to the hospital? Do you need to call an emergency contact? Can they drive home safely, right? These are things you want to think about. Is there a reason to refer them to employee assistance for drug and alcohol? So you want to look at some of those. And I would keep in mind too, usually I will ask when the call comes to me, let me see their contract, if they have an employment contract, okay? Because that's going to dictate maybe some rights to get paid leave or disability, right? You want to have all your ducks in a row so that if you had to put that physician or that clinician out on leave pending an investigation, what are my obligations as far as pay? And then some of the other things that you want to consider as far as employee rights, and we'll talk about that a little bit more later, are there short-term disability rights? Did they get hurt on the job, right? They need workers' comp paperwork filled out, or family and medical leave, which again, we could talk a little bit more about that later. All right. And feel free to chime in if I'm missing anything. Protecting the work environment is also a key consideration. So you want to make sure that if it's an issue where maybe the person is suffering from a mental health issue, but they're engaging in behavior that constitutes sexual harassment or creates a hostile work environment, right? Even though you know that it's because of a particular medical condition, you still need to take steps to protect the work environment. And at times, I have assisted clients of ours with calling the police. I mean, it doesn't happen very often, but you can have someone who becomes so unhinged that regardless of your efforts to help them get well and point them in the right direction, there may be some real concerns about safety at the office where we've guided people on, and you have to think about, do I have to change my locks? I've had practices that have had to have a temporary security guard, cameras, escorting people to a parking lot. And not that I'm trying to get everybody nervous, but these are the things I want you to think about when you're confronted with certain behaviors. And again, it's the multifaceted approach, the big picture approach that you have to think about. All right. And I would keep in mind, update your policies, your handbooks, make sure that there is a mechanism for employees to report if they need accommodations or they know how to access the employee assistance program and other benefits that may be available to them. Okay. Should I move on to the next slide? Are we ready?
Let's do it.
Okay. Some other things that I want everybody to consider is medical clearances, right? And getting people back to work. You may know that they were in a treatment program, right? And now they want to come back, right? It is perfectly acceptable to request documentation to make sure that they can safely return, whether it's a treatment program or anything else, okay? Now, you're not entitled to the specifics of the diagnosis and all the nitty-gritty detail, but you can ask for something sufficient that you're satisfied that they can resume practicing in their field. And at times what I've done, especially in certain fields where you know there's a lot more potential patient safety risk, is I will give a job description to the medical provider and say, for instance, I remember doing this, it was an anesthesiologist. This is what so-and-so does, or maybe so-and-so is an anesthesiologist. Please provide clearance that so-and-so can safely resume the practice of anesthesia, on such and such date, with or without any reasonable accommodations, because medical clearance for an anesthesiologist is going to be very different than the front desk receptionist. So I won't necessarily take on face value a very generic medical clearance that in a situation where there's high risk to patients. Have you come across?
I'll add to that, just that one thing is a generic job description a lot of times falls short, and kind of what you're saying is really important, that the person requesting the clearance needs to connect the dots as to how your concern ties to which responsibility in the job description. Some job descriptions are great and it's obvious and we can connect the dots. Other times it's difficult and why this concern is tied to a specific responsibility and how connected. So giving a job description, connecting the dots, explaining what exactly you're looking for when you're requesting clearance is really important. Also, I would highlight that a lot of times employers feel that sharing information regarding the patient with the clinician is a breach of confidentiality, or it's a HIPAA concern. All of that, actually, if we can get information to the providers on the clinical side, there is no issue, right? It's information the other way that we get into a problem and can discuss that. because there's some more complications there, but disclosing information regarding your concerns of an employee to a clinician or provider in order to get clearance, the more information you provide, the better. There's no concern there. And even though we can't always discuss the case with the employer could certainly share with us what is going on, where they're seeing issues, what they're seeing issues with. The more information, the better.
Absolutely. And, that leads me to the next bullet point. It really is a one-way street in a lot of ways where the employer can give that information, but you have to be careful about probing or even contacting directly. I usually do it in writing if I'm going to, give a job description of what the issues are, because when employers call a provider, undoubtedly, the employee will then say, well, you got information you weren't entitled to, and you're making decisions, or maybe you fired me because you found out I'm in cancer treatment, and that was information you weren't supposed to know. So I'm really, very cautious about that. You may also doubt the validity of a doctor's note, right? They maybe have been out, you think they were in Vegas, right? Don't pick up the phone and call the doctor directly, write a letter. And that's stuff we help our clients put together, because you can run afoul of some legal requirements. Now, when some of these issues present, maybe it's the employee who was clearly drinking on the job, taking drugs, maybe it was a drug diversion type of case, right? They may look for an opportunity to just leave quietly, gracefully, okay? And it's all going to be fact specific. It doesn't mean that you're not going to do your own investigation, protect your patients, protect your practice, but there may be scenarios where a person can kind of bow out, right? And I've seen this particularly in cases where the employee is caught diverting drugs, right? Writing prescriptions, whatever it might be, at whatever level. And so they're looking to, find a way. It doesn't mean that the reporting obligations are gone. So don't have a comfort level, oh, they left, I don't need to report it. Sometimes certain things are reportable to OPMC or for nurses education department. So you'll have to look at that. As far as contract considerations, you would have to look at that too. So, maybe you want them to leave without like a for cause, maybe you'll do a without cause. But you want to walk through that carefully, make sure you know if there is a contract there that you can refer to. Some people decide, you know what, I think it's time for me to retire. Do not, though, tell an employee, I think it's time for you to retire, right? That's not for you to do. And that you can wind up with an age claim. But let's say you have an older clinician and they seem to be forgetful, hands are shaky, things of that nature. Address the performance issues. 9 times out of 10, they will own it and say, you know what, you're right, I'm not as focused, I'm not as this or that. Then you can have the discussion or dialogue about either accommodations, or is this still the right thing for you to be doing? Maybe there's an alternative role. I've seen doctors sometimes transition into like more of an IME practice, different role than maybe the high pressured surgical and anesthesia type of positions. So there are some options to consider when there are these mental health or other disability related issues that you can think about, that you should think about. Another thing too.
I would just add that the more you're a partner with the employee in this process, the more cooperative they are, versus starting it from a place of risk management, insulating yourself from exposure. If it becomes hostile in the beginning, it usually stays that way. Whereas if you're transparent in the beginning and you present that this is how you're protecting patients, this is how you're protecting the business, and this is how you want to help them, and there's a clear path here that we're going to follow, and these are the steps we're going to take, more often than not, I've experienced that employees are partners in that journey. And appreciate the fact that you're being systematic, and it makes sense to them that you want to protect patients. It makes sense to them that you want to preserve the integrity of the business, and they appreciate the fact that you're also willing to help them along the way.
100%. And I do think that having those conversations, and actually, I hate to say it, leaving the lawyers out. When I show
Yeah.
up on the scene, front and center, the back is up for the employee, versus I can be behind the scenes and kind of script out the right conversation to partner with the employee and put them on the path that Dr. Aldad was talking about. All
Absolutely.
right. So, hold on, let me just, okay. So this one, other things to consider, right? Reasonable disability accommodations, okay? And this is one of the things a lot of our clients struggle with. They could be a small business, they could be a large business, but limited resources, limited staff. And the important thing here to remember is that you have to give due consideration to each situation, okay? Once an employer knows or has reason to know, even if not expressly told to them, that an employee has a disability and it may be affecting their job performance, there is a duty to discuss and provide reasonable accommodations. Sometimes there isn't a reasonable accommodation to provide, and that's fine. But there is that duty to discuss. In fact, it's called the interactive dialogue, okay? Too many times I hear clients will say, and for understandable reasons, I can't do that. They just asked me for light duty. There's no such thing as light duty. I'm going to say no. Okay, that might be the ultimate conclusion, but you have to do it in a step-by-step process. You have to engage in the dialogue, because if you don't do the dialogue from a technical standpoint, you have violated the Americans with Disabilities Act and whatever the counterpart is for the particular state you're in, okay? So you want to have a discussion. You want to flush out what are the issues, what are the job limitations, and you only have to provide accommodations that would not impose an undue burden on the business, right? And that can be really fact specific. So the light duty thing, there are different scenarios with that. Most of the times after you flush it out, nurses on light duty are probably hard to provide that accommodation. But I have done it or have recommended that it be done. Maybe that particular nurse is more administrative, right? They call the patients back, they deal with medications and scripts and scheduling things, right? Then, a light duty could work, because it could be a part-time administrative nursing role on a temporary basis, and then it's possible. So the other thing I've had clients find themselves with some difficulty is that you also have to look at alternatives. So maybe the person has high anxiety, they're stressed, they can't do the particular role they're in right now until their medication kicks in, they're on a new treatment plan, but you have this opening in another area. Maybe it's lesser pay, which is fine, but you could potentially have an obligation to discuss with them this alternative option. Then there are the ridiculous things. I've had situations where people have said they're the manager or supervisor of an entity involved with compliance, but they don't like talking to people. It causes them anxiety. Okay, well, what do you want me to do with that, right? But I can have a dialogue and say, all right, well, that's not reasonable. Your job by definition requires you to be able to deal with crisis situations, deal with people. You can't say that working after 5 o'clock just doesn't work for your mental health, right? Well, then this isn't the job for you, and I can establish 10 different ways why this doesn't work for you. But I couldn't automatically dismiss it out of hand. I had to go through the process, get a doctor's note, sit down with the employee, and then document. Most states will have a documentation requirement. So in New York, if you ask for an accommodation, you have to get something back in writing that says it was granted or denied, okay? So, and we see all kinds of things, whether it's, most recently I heard one about an emotional support animal, it can really be anything, or one, I need time to lay down and rest because of some neurological issue, I need a private office, right? All things we got to talk about. And what's an undue burden is various factors, right? What is it they are asking for? The profit margin, not the profit margin, the ability of financially of the entity to provide the accommodation, right? You want an elevator bank put in, right? That's likely not going to happen. Other things I've said financially aren't going to work. Your insurance didn't cover a prosthetic leg. You know, I'm not going to get you a prosthetic leg. Financially, that doesn't make sense. So I'm sure you've come across all kinds of things that you're.
Oh, no, for sure. And you know, you took the words right. I was going to say document, and that I cannot emphasize it enough because sometimes it feels silly. During COVID, we had a lot of people who said they need to be camera off for various
Oh,
reasons.
yeah.
Some people we said it's okay. Some people we said it wasn't okay. Some we documented well. Some in passing we granted, but it wasn't. You know, it was added to their charter or their employee records, and luckily we didn't have issues. But I would say that the importance of documenting can never be overemphasized, even if it feels silly, even if it's something
Right.
small and HR grants it and it's not a big deal. It almost it's the same thing like we tell our clinicians, if it's not written down, it never happened.
Right.
Period.
Right.
Whether you think it did or didn't. And then there are some things where, like you said, they are a burden on the business and therefore unreasonable. But so long as everything is documented and some sort of analysis was done to try in good faith to accommodate, and that could be presented if necessary, that's very important.
Yeah, I see that a lot. I don't know if you get a lot of requests for these from your patients, but this request to work remotely, which is a product of COVID, right? So we still
Sure.
have people for X, Y, and Z reason, I need to work remotely, right? But you don't have to just roll over and say, well, I did it in the past, I have to do it again. And again, as Dr. Aldad was saying, do the analysis. And have that discussion. Well, why do you need to work remotely? Oh, you have a gastro issue. You need to be close to a bathroom. Guess what? I can move your desk or your office space right next to the bathroom on the such and such floor. You're good to go, right? You can be creative in dealing with some of these work from home requests.
Sure.
So, and again, we're happy to work through any of those with you as well. So now, I'm just looking to see if there were any little tidbits I wanted to give you as far as examples, but I know we have a couple more slides to get through and we're running a little low on time. And I will mention, I'll say it again at the end, I should have said it at the beginning, if you have any questions, there will be a Q&A session at 3:30. You can probably put them in the chat box on this particular program, and then we can follow up with them later in the day at the 3:30 session to answer any of those questions. Okay. Some of the things I'll tick through really just quickly on this slide. Be mindful of, there's the Federal Family and Medical Leave Act. So if people are suffering from health issues, mental health or otherwise, they may be eligible for leave. These are for larger employees, 50 and more employees. However, most states have a comparable statute that has a lesser employee requirement that may be applicable. There are state sick leave laws. So you can't say right away, oh, the person has no time. They need to be off and they need leave. You can't automatically just dismiss it as I don't have to give it. And frankly, regardless of all these laws, under the various state and federal laws, leave can be considered a reasonable accommodation. So even if they have no time in their bank, that could be possible. And there may be situations where you have to report it to workers' comp. Now, you might not believe that their anxiety is stemmed from the workplace, but if they make a complaint and they say, this is causing me blah, 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 and I'm getting treatment for it, report it to your carrier, let your insurance company deal with it, because you don't want them run afoul of, I didn't report or submit the paperwork, okay? And work with your HR department or your outside legal. They can help you walk through some of that. I think you wanted to speak to some of this about jumping to conclusions. I'm happy to speak a little bit more of this, but when But important thing, as we've been saying all along, is do your due diligence, do your investigation. The employee that smells like alcohol, slurring their words, right? I have come across scenarios where when I investigate, sit down with the employee, or the employer sits down with their employee, they find out they're on a new medication, it's still being adjusted. So that's why they seem to be a little out of it, maybe sleeping on, their head falling down or sleeping. It wasn't about an alcohol related issue. So you really have to make not jump to the conclusions, and do your due diligence, because I've even had
Absolutely.
situations with divorces, childcare issues, like they may be falling asleep at the office because of other personal outside reasons.
Absolutely. No, the investigation is key. Being objective with each situation you're presented, and like we said earlier, following some sort of system where you're analyzing exactly what happened, and not being biased, or being aware of your biases is really important. Also, I've noticed sometimes there is a need for, if someone discovers that they were taken advantage of for whatever reason, the next person who has a request becomes the sacrificial lamb to demonstrate to the rest of the company that we will not tolerate this behavior. That is a huge, huge trap that you could fall into, and you need to be very, very careful that it
Right.
could be somebody was disingenuous, was dishonest, whatever it was. But the mentality of wanting to pick a sacrificial lamb will always end up hurting in the organization and jeopardizing patients and future employees. The strategy there is to really assess flaws in your policies and procedures, and implementing something that impacts everyone in the company to prevent something like that from happening again. So it doesn't mean that if there was a gap in a way in one of your processes and someone took advantage of it, that now you need to overcorrect with the next person. You just need to implement solutions to make sure it doesn't happen again, and then be systematic and methodical moving forward of all future investigations.
Absolutely, absolutely. Also, when you do an investigation, just a little pointer here, make sure you have the right people involved, have a second person there, assume you could be recorded. And I really would urge everybody, don't go into those meetings kind of thinking, oh, I'll just wing it, see what they have to say. Have an outline, the things you're going to talk about. Say up front that, if it's an accommodation discussion, like, look, we received your request, we consider all reasonable accommodations, we want to go through the process. Go into it in good faith and make sure that you're saying things that, if you are recorded, aren't going to get you in trouble. Okay. One or two more slides. I think we have about 5 minutes left. So, and I think you already started talking about a few of these things here, but I'll hand it over to you.
Sure. No, what's important to realize is that at the end of the day, your interest is to protect the business, protect patients, and at the end, your last point is to assess how you could help the employee. Now, that does sound a little counterintuitive. I think most people want to help their employee first and foremost, but there are things that you have to put in place to protect the interests of the business and your patients. And once you know that you are in a safe place, then you could focus on the interests of the employee to the extent that it's appropriate. What happens a lot of times, though, when you do this, is that boundaries are difficult to appreciate, and patients could over-disclose. An individual from the people or HR department could go above and beyond to support them and assist them, and that actually becomes an exposure to the organization. So it's really important to realize that if an employee is addressing a concern, they're not coming as a friend to somebody in the people department. At the end of the day, they are an employee, and we need to stay objective when we're assessing exactly what is the situation. Are they entitled to an accommodation? Are the patients safe? Right? And answer the same set of questions every single time, and not try to just be a friend and supportive. And then at the end of the day, it creates a situation where at the end of the day, you come back and there's band-aids to correct for what ended up being way too casual approach to the problem. Now, what happens with setting all these all this kind of like architecture into understanding this situation is people start, unfortunately, making exceptions. And we see that a lot with a top performer, that at the end of the day, well, this is my best salesperson, so I'm going to treat him differently. Or it's my worst salesperson, and therefore I'm going to treat him differently. Or my best physician, my best PA, my best NP, whatever it is. There's sometimes situations where someone might have immunity, someone might not have immunity. There's nepotism in organizations. Someone might be more likely to get disciplinary action versus others. So when assessing these situations, these are the biases I talked about earlier. It's really important to make sure you're not falling into what's like a top performer conundrum, where you assess somebody based on their performance and hold them to different standards and make your decisions based on factors that are not objective. At the end of the day, whatever is decided and becomes the roadmap for this individual, there needs to be constant ongoing monitoring and documentation along the way to demonstrate that in good faith, the organization was protecting itself, its patients, and the employee, and the people department was acting in a way that is compliant and consistent both with federal, state, and corporate policy and corporate governance. So documenting, monitoring along the way to make sure that in the event that this does escalate, which hopefully it never does, there is some sort of track record that could be referenced to understand exactly what transpired.
Agreed, agreed. All right, and I think this might be our last slide coming up here about no good deed going unpunished. When you're trying to help employees, and I think that's what you're talking about, too much is sometimes too much. But you can't put your head in the sand either, right? So if you know that there is a problem, maybe it's the disruptive clinician and they're causing havoc in the OR or whatever it might be, while you don't want to know every in and out of their personal life, their divorce or whatnot, you still have to make sure that you're protecting the work environment, right? But on the flip side, I have clients, you're in healthcare, you want to help employees, but that boundary setting that you were talking about, when I have a client that tells me, yes, I drove them to the doctor. I didn't just drop them off. I walked them in and I went and sat in the exam room with them because I thought I would be helpful because I have some background in such and such, right? You are becoming privy to so much protected health information that you think you're doing them a favor, but guess what? 6 months later, when the performance is so bad and you're justified in terminating them, that you could find yourself with a claim that says, you know what? It's because you knew X, Y, and Z, and you're terminating me because of a disability reason. So it's really walking that fine line, being helpful, providing the guidance, not putting your head in the sand, right? But not overstepping either. So that's really
Absolutely. And then saying that is okay. There's many times an employee will want to share their entire life story, and setting the boundaries and letting them know, listen, I really want to help you. I need you to tell me exactly what I need to know. Where is there an issue? And then I will tell you what next steps look like. You don't need to give me more details that are irrelevant or give me extra context beyond what is necessary for me to understand where the problem is here.
Absolutely. And I think we'll leave you with the last point about, can I fire the employee? Look, that's the case-by-case assessment. Something presents, you got to do that due diligence. I will note that there are situations where if an employee does admit to having a drug and alcohol issue and they are using on the job, and that's why they were caught, right? They were caught because they were under the influence on the job. That's not protected from a disability standpoint. However, if the employee checks themselves into rehab before there's any disciplinary action, then that is protected. And you can't automatically say, oh, I'm just going to terminate they have some kind of addiction issue. Okay. Mm-hmm. So there is a distinction to being caught red-handed, violating the policy that you can act upon immediately versus, okay, I'm going to proactively find help. That's protected. Right.
Absolutely. We see this question a lot in addiction psychiatry. If someone uses recreationally once a month, mm-hmm. and their employer finds out, are they at risk of losing their job?
Right, right,
And then the question is, does it impact their work at all? Do they ever use on the job? Are patients ever at risk? And then when you
right.
dig deeper, you find out they, once every 6 months they use cocaine. You shouldn't have even known that as their employer.
Right, right. And now with certain protections with recreational use of like cannabis, there's a whole host of, that's for another
Oh yeah,
class on what, I mean, a lot of times we don't even screen for that or recommend our clients don't even screen for
that's
cannabis
right.
use.
That's right.
So
They'll have to tune into our next episode to hear more.
exactly, exactly. And with that, I think this is a good breaking point for us here. And really appreciate the time having been here today. Hope we gave you some practical pointers and some good information that you can apply in your professional practice. It's been my pleasure working with Dr. Aldad today. And again, if you have any questions, put them in the chat room, send them in to my office, and we will try to answer them at 3:30.
Absolutely. It was great being here. Thank you for joining us.
Okay, thank you very much.